Are you really entitled to something that you don't entirely pay for when 50 to 66% of every medical bill that you generate is paid for by somebody else? Only taxpayers in the hundreds of thousands of dollars actually break even, meaning they actually pay for their Medicare. Otherwise, we're all in the hole. We're creating more red ink. So what are the options? Number one, you can make the middle class pay more. That's probably not going to happen. You can cut doctor pay. We tried that. It didn't work. You could cut seniors' benefits. That's political suicide. You could eliminate almost every other government program, or you could let people die when their money runs out, or you could ignore the problem and transfer the debt to our kids.
You put in this money over the years, right? It's $55,000 for a man, and you spend 100 and something when you come out. But isn't time is also a factor of money, right? If you put in money early, it tends to grow. Like if I put $55,000 into my 401k, right, over time, by the time I retire, it's going to be a lot more than $55,000, right? Because it's had time to grow and to compound, and so isn't that what's happening here? Is that people putting in the money early? They drip it in week by week by week by week from the age of 25 to 65.
All right. You're losing me, Ellis.
We're making a big deal over this gap, right? That the medical care costs more in the end than the person put in, right? And we're worried about this gap. Right? That's what we're all worried about here. What I'm saying is, since you put the money in over a course of perhaps 40 years in somebody's work life, shouldn't you get a lot more at the end because you're putting it in so early?
You're talking about the magic of compound interest.
Well,
you're assuming. Well, sure. I mean, I'm sorry. That's an economics term.
We get it. We understand what that means.
The thing is, sure. The thing is, you're assuming that money is in a lockbox somewhere.
Okay. Well, then, what are they doing with that money?
Lots of things besides helping seniors.
The dollar I
No.
give when I'm 25 years old.
But do you hear what Sue's saying?
I do. But let me make this point: the dollar that I give that I spend when I'm 25 years old, and I'm not going to get it back till I'm 65, right?
Yeah.
That dollar's worth a lot more all those years later, isn't it?